and very valuable panelists about all of the great work happening on campus to keep us all happy, healthy, and well. So we do still have more people loading in. Thank you for your patience as we bring everyone together. All right, we seem to have stabilized a bit on the loading in, although I do still see some folks coming in from the waiting room, but I think we can go ahead and get started. So thank you again, everyone, for coming to our November town hall. This one is very focused on the excellent work that UCI has been doing to address our issues of health and wellness on campus. Also to tell you all about resources for graduate students and postdocs, and really for lots of other folks too, but of course we're focused on grad students and postdocs. I'm Jillian Hayes. I'm a professor in ICS as well as the Dean of Graduate Division, and I'm just going to introduce all of our wonderful panelists, and they have each of them a few minutes to sort of speak about things that are pertinent to our conversation today around the work that has been going on in COVID-19. I would also really strongly encourage all of you who are in the Zoom watching to answer, or ask rather, any questions that you have in the Q&A. And as we're going through, I will try to direct those to the panelists. And if you are watching this on one of our other platforms where we're streaming this, we will try to get to you, but it's not always consistent as to whether we can see questions that get posted on those other platforms. So if you are sure that you have a question, you want to make sure it gets to us, please come to the Zoom version of our town hall. So thank you again, everyone. And with that, I am going to hand it over. We're going to kick off with the man who has taken on the Herculean task, truly, of doing something probably no one wants to do, which is to be the COVID czar for the entire campus. So thank you so much to David Souleles for being here today. He's been behind a lot of really tough work the last several weeks. So we'll have him introduce himself. He's new-ish and returning to campus and give you a little bit of an update on what's going on. Thank you, David.
Great. Thank you, Julian. Yeah, again, my name is David Souleles, and I'm the COVID-19 response team director for UC Irvine. I am an anteater. I graduated in 1987 with my bachelor's degree in psychology, and actually worked for UCI for about 6 years before moving on in my career, and most recently served as public health director here in Orange County up until May of this year. Rejoined UCI in August as the COVID-19 response team director, and so happy to be here helping out the campus really work towards kind of reintegrating campus life, right? Trying to get us back to some level of capacity to where we were before this pandemic began. And unfortunately, 8 months into this pandemic, I think we're all a little bit surprised to have found ourselves here and still in the midst of this in a very big way, and likely to be in the midst of it for many months to come. So part of what we have been trying to do on this campus is really look at the ways that we can put in public health measures that will help us to really reduce the risk of the spread of COVID-19 among our campus community. And that's particularly important right now if we take a look at what's going on in this country. We are seeing record COVID-19 case reports across the country. Hospitalizations are escalating in many states. Here in California, we have been in a little bit better shape, but I will say in the last few weeks, our cases have been rising pretty significantly. That's been happening throughout Southern California as well, and really beginning to happen here in Orange County. We had a period of time for quite a while where our daily case counts were below 200 cases per day in Orange County. I'm just looking at today's numbers, and the county reported out 598 COVID cases. So we are definitely seeing an increase in cases occurring. So we have a number of strategies we've put in place on campus to really help reduce the spread. Dr. Chang is going to be talking about our COVID-19 asymptomatic testing program, which is one component of our work. Another piece that I wanted to talk with you for just a couple of minutes about is our contact tracing program. And I think we've all kind of heard that in the news. You may have, you hear it talked about a lot, but in terms of what that means for us here on campus. So contact tracing is really a tried and true public health tool that we use to help control the spread of disease. And it basically is what it sounds like. We talk to every COVID positive individual who is reported on the campus, whether that's a staff member, a faculty member, or a student. And we do a pretty extensive interview, try and understand where the individual may have been exposed, try to understand who the individual has been in close contact with, and then really try to understand the living situation and health situations so that the individual who is COVID positive can safely isolate until they are no longer infectious, no longer able to infect other people. And we do this all under the authority of the local public health department, which here in Orange County is our Orange County Healthcare Agency. Once we've talked to that case, we will then make an effort to reach out to every individual who has been identified as a close contact. And what is a close contact? We hear often. A close contact is defined as somebody who was within 6 feet of a person who is COVID positive for a cumulative time of 15 minutes or more over a 24-hour period. So you can begin to understand why we put so much emphasis in our campus community about maintaining a physical distance, because it makes a big difference in terms of the spread of disease. But anybody who's identified as a close contact, we will call and we will interview them as well, provide some instructions on how to safely quarantine, because anybody who is a close contact will need to quarantine for 14 days from the time of their last contact with the COVID positive individual. And we're very fortunate, particularly for those who live on campus. Our campus housing program and our campus social work program are amazing. They are doing good work to make sure that people can safely and effectively isolate and quarantine. Good support in place to make sure meals are available, et cetera. So we work really hard to make that as easy as possible given the difficulty of the situation. We also provide the same kind of support for UCI students, faculty, and staff who don't live on campus. So we will do the same type of interviews and coordination and support. And in fact, for many of our students who live off campus who have had to isolate or quarantine, oftentimes they lived in apartments with 4 or 5 other people, and we needed to decompress that apartment. We needed to get people separated so they could effectively isolate and quarantine, and have been able to bring people onto campus housing, working with social work to do that. So as I think you're beginning to understand, it's really about breaking the chain of infection, because we know that if you're a close contact, you may become infected before you realize it without any symptoms, and you may be able to infect other people. That's the main principle behind us all wearing masks, and the main principle behind us all being physically distant. So as you begin to see all of these pieces work together, one piece does not work without the other. Without testing to identify people who are asymptomatic, people may inadvertently be spreading the virus around. So our systems are really set up to do that. I will say that we get a lot of questions about, well, why should we talk to you? We're a little bit nervous about what you might do with that information, right? So I'll tell you a couple of things. One is your medical information is confidential. So if you're a case, we never share your name with any of those contacts that we talk with. So we will always protect your privacy. And we also really need you all to be upfront with us when we call and talk to us about all of those potential places where you may have been, all of those potential people you may have been in contact with, because that's the only way we can effectively do our contact tracing. And, I've heard people concerned that perhaps if they share something with us, we would then call student discipline. and turn that information over. And we will not do that. So our paramount, what is paramount to us is getting the best information possible so that we can make sure everybody is as safe and protected as possible, and we can help break the chain of infection. So that is really the big focus of not only contact tracing, but our testing program and all of the other policies that have been put in place on campus to really help us reduce the spread of disease while helping us to get back to some level of college experience that we're all, I think, wanting to have. I think that said, it's sobering times. We are in the middle of a global pandemic that really none of us have seen in our lifetimes, really unprecedented times for us. And it is taking a lot of personal sacrifice from all of us as a community to be able to assure that our community is safe and healthy. And we'll continue to have us being all in together for the safety of our community, because, with something like COVID, it's not just about us. It's not just about if I get sick or if you get sick or become infected, but it's the risk that it creates to our community, and particularly those most vulnerable in our community, our older adults, our people with underlying health conditions who may have very serious outcomes and potentially death if they become infected. And I don't think any of us want to be in that circumstance where we inadvertently transmitted to someone we love, someone we cared about. So really working to put all of these pieces in place to help protect our community. And that said, I'll just kind of close with one other thought as we're thinking about the holidays, right? Thanksgiving is coming up. I know a lot of us are wanting to think about how we might be able to be with families. The provost sent out a nice communication yesterday for a number of things to be thinking about coming to the holidays. And I will tell you, particularly for those of you who live on campus, you'll be receiving some communication from housing shortly, but our recommendation really is if you travel for Thanksgiving and choose to go home, we really strongly encourage you then to stay home for the remainder of the academic year. If you can, effectively complete your education remotely from home. That will really reduce the risk of you potentially being exposed while you're at home and traveling back to campus with COVID. We want to, again, keep you healthy, keep others that you may encounter while traveling healthy, and keep our campus healthy. If you really need to be here for the remainder of the academic year, we would really strongly encourage you to stick around, right? To not travel home for Thanksgiving. And we know, again, that's asking a lot, but it really will help to reduce the risk of COVID being brought back on to campus. And I know for those of you living in housing, dining is working on some meal options and other opportunities to support you for the holidays. If you must travel, though, and you do need to come back, we are going to ask that you sequester for 14 days upon return, and you'll need to test within 48 hours of return and test again within 2 weeks. And again, these measures and these steps are really are being put in place really to protect the overall health of our community. We know there are significant levels of COVID infection rates throughout the country and all throughout Southern California as well. And so these measures are really being put in place to protect the overall health of our community. So all of us on this Zoom today, I think, are having to make those difficult choices for ourselves and our families as well, and what we choose to do and not do. And this may be the year where we need to take the pass and think of the greater good and the greater support of the health of our communities. So with that, I'll wind down and then be available for other questions as we move through. Thank you.
Thank you so much, David. Next up, for those of you who are staying home, we actually have an expert in how to do that in a safe and healthy way. Scott Bartell has been a wonderful advocate for all of you doing research and teaching and learning at home as part of our grad curricular planning for this whole year, but also has some more to share with you and talk a little bit about that from his expertise and his research.
Thank you, Jillian. I should say, actually, my area of research is not ergonomics, but I am a professor in the Department of Environmental Occupational Health, and so I have some training in that area and some basic awareness. And this is actually, I think, really important. You know, we're all very focused on the pandemic. There's a lot going on with COVID that's very urgent, very important, and we need to pay close attention to be thinking about that. But at the same time, there are other issues that affect our health, right? And we can't forget about those other things. So I want to just give you a brief reminder in case you haven't seen this information, or in case for some of you this might be new information about just some basic ergonomics tips that are particularly important as you think about working at home. And I'm going to focus today on sort of working with a computer at home, because I think many people have experienced, including myself, challenges during the pandemic with, you know, finding a good way to be comfortable working, you know, say at a laptop all day long, which is not easy. And that's because the laptop itself is horrible. From an ergonomic perspective, it's a horrible device, because it actually violates several key principles of ergonomics. One of the most important principles of ergonomics for working with a computer is that you should have the top of the monitor aligned roughly with your eyesight, right? And so that you're not looking up basically or way down at the monitor, right? And at the same time, you should have the keyboard that you're working in, the mouse that you're working on, or a touchpad, at about elbow height with your arms at right angles. Now, if you look at the distance between your elbow and your eyes, for most of us, that's like 20 to 30 inches, which is way, way taller than any laptop screen I've ever seen, right? So if you just look at the distance between the keyboard and the top of a laptop screen, you'll realize that it really it's pretty far from those recommendations for what makes a comfortable work setup. So everything I'm going to tell you is actually summarized very nicely with a lot of detailed links on a handout from our university's Department of Environmental Health and Safety. I've just copied a link to that document in the chat window here in Zoom, so that's available for everybody. It's a fantastic summary, actually, that was just put together in March near the start of the pandemic, because of course they realized this would be an issue for a lot of people working at UCI. And so if you haven't seen that, I really recommend that you take a quick look at it. It's a great reminder in case you haven't thought about ergonomics lately, but especially if you're struggling with like neck pain, shoulder pain, wrist pain, you know, any issues that might be caused by repetitive strain, and particularly, you know, a suboptimal setup for your laptop or your home workstation. It's a great review of kind of key principles, including some photos of way you can improve your setup, even if you are going to be working on a laptop. You know, one way to do that is to buy an external monitor, which usually are not too expensive. For $100, $200, you can get a decent external monitor. But even if that's kind of out of the realm of your price range, there's some photos on this worksheet of how to even do a decent setup, just stacking textbooks or boxes, or even putting your laptop on top of a microwave, which is one photo on that document, which I love. And then just plugging in an external keyboard. I'm going to show you very quickly, and I don't want to take up too much time for this. I'm going to do a quick share screen to show you a couple photos that might be helpful for those of you who are struggling with any of these issues. So let's do this, and let's see. Hopefully you can all see my photo. This is page 2, if you can see my screen, of the document from EH&S, and you can see a very nice couple examples here, right? You can see this is not a very expensive setup to do a more ergonomically sound setup for both sitting and standing, working, say, at a table at home or at a counter. Just using, you know, things you might already have on hand for the most part, you know, with possible exception of an external keyboard and mouse. So, you know, this can be done inexpensively. There are also expensive options if you want a fancy workstation. But I think most of us are a little cost sensitive and appreciate the ideas. I'm just going to show you next a photo of my work setup, because I really also don't have like a dedicated desk at home in my condo. And so I use something that's a little more expensive. There's a riser that was maybe $50 to $100, but not too bad, that I sit my monitor on my keyboard, and that can actually raise into a standing position. It's adjustable, so it can go quite high or it can stay lower. And then I use a pretty inexpensive Bluetooth keyboard that just connects to the laptop. I think it was $20 or $25 at Amazon. And it's got a nice low profile. You'll notice it has a bend. So ergonomic keyboards usually have a little bit of angle between the two halves of the keyboard, so that you basically let your elbows come out a little bit, which you type, which again can help a lot with repetitive strain injuries. So again, just a couple quick suggestions here. A lot of detail available in the document. There are many links to more detailed kind of advice in this two-pager from EH&S, so I recommend that. And I'll just close by saying, in addition to the issues of the computer setup, just remember, general advice too. Take breaks, right? And this is whether you're at work, at home. Don't, sit in the same position for 8 hours in a row. Get up, take a walk, take a break. And that's, both for physical health, but also for your mental health. It's really important. We're all under a tremendous amount of stress. Now, I would say it's more important than ever to make sure you give yourself time and space to take a mental break from what you're doing. Take a walk, try to get some exercise in a safe way, because that's important as well for maintaining your health. And I think I'll just leave it at that. I'll stick around for any questions.
Thank you so much, Scott. Normally I wait for questions until the end, but this is a really specific one. So let me throw this one to you while I've still got you, which is, can you speak about a kneeling chair?
That's an interesting question. I'm not familiar with the research on how well that works. I have tried a kneeling chair myself, not in the last couple decades, but I did use one for a while. I did not stick with it. I did not find it as comfortable as just sitting or standing. And I honestly don't know if I just didn't give it enough of a try, because I probably gave it a few weeks to a month kind of duration before I gave up on it. But I would say, with a lot of these things, just, try and see what works for you. You can also read reviews, if you're checking out equipment on Amazon. My experience is, those reviews can be pretty helpful if you spend some time reading and seeing what other people's experience will be. There's no guarantee it works well for you, but I think for a lot of ergonomics, it's really trial and error. Honestly, I've been through 3 different external keyboards since the pandemic started until I really settled on this. This actually the least expensive of the 3 has worked best. This low profile Bluetooth keyboard. So I wish I could give you some general tips on exactly which device and which chair, which setup. But I would say, try different things, see what works for you. If you have the ability to do that, is kind of my best tip, because you'll feel it, right? If you're feeling a lot of soreness, and then that's, in pain, then that's probably an indication that something's not working for you in current setup and you need to try something else.
Thank you. And thank you also for setting up so nicely that we must, of course, balance our mental health and our physical health, and those things are deeply intertwined. So I'm next going to invite Francis Diaz, who runs our counseling center, to speak about mental health, and then we'll pass that off to Fong Luong, who explicitly addresses graduate student mental health.
Great. Thank you so much for having me. I will keep it brief since I know we have a number of other topics we want to talk about, but mental health is really important. And as we've already talked about, we are in really unprecedented times. The life of a graduate student is already really challenging and stressful and difficult, all the things that you're managing on a regular basis. And then we complicate that even more by this current pandemic, the impact to socialization, increased senses of isolation, just trying to adapt in our home environments. For those of you who have families that are living with you, trying to stay focused and not having a separate space necessarily to go to. Over and over and over, this kind of situation begins to have an impact on our overall wellness. And so as a campus, we really want to make sure that we are attending to the mental health needs of our students. We have a range of resources out there. I really encourage you to check out our website. It's counseling.uci.edu. We also have a number of social media pages including our Instagram, Facebook, and YouTube. And on YouTube, we have a series of short 3 to 5 minute videos that include tips for socialization, tips for managing in this time of COVID, how to connect with others from a distance. And I think it's really important resources. We also want you to know that at the Counseling Center, we have very specific resources for our graduate students. We have a series of workshops. They occur on Thursdays from 4 to 5. And they go through various topics like imposter syndrome, dealing with dynamics, academic dynamics, and working with our professors and faculty, which are part of being a graduate student. Just because we're in COVID, life as a graduate student doesn't necessarily stop. And so we want to make sure that you have those resources. I often will encourage students to connect with FONG. I think it's a great resource. Not every student feels like they want to walk into the Counseling Center or come into the Counseling Center for mental health services. And so there are other general wellness resources that FONG can be a great resource for as well. But if you do find yourself in a situation where you are feeling like you would like to talk with a licensed mental health provider, the Counseling Center is still here. Everything is being done currently in teletherapy. But you can call our Counseling Center main phone number, which is 949-824-6457, and you'll get a live person, and we'll help get you scheduled so that you can meet with one of us and help walk you through whatever's going on in your life right now. So I'll keep it brief, and I'm going to pass this over to Fong, who we work very closely with on our campus so that we can help provide you the support. So Fong. You're on mute, Fong.
Myself here. Thanks, Julian, and thanks, Francis. It's great to see all of y'all. Like Francis said, yes, we work very closely in terms of how we refer students back and forth between the Counseling Center. And what I do is more general academic / wellness counseling. Just a little bit of background. I have a clinical background, but I've worked in academic settings. I've worked in disability settings with Francis back in the day, years ago. So we go way back in that tiny office, if you recall, Dr. Diaz. Here in this role, I'm going to describe it more as a non-clinical academic mentor, academic coach position. So broadly speaking, I work with students, if you don't already know, on such issues as work-life balance, communication skills, and stress management in an academic or research setting. More specifically, the things that have been coming up this quarter, certainly stress around elections, fires, research, finances, isolation. So because of this thing that's going on right now, this moment of, for some, trauma, this moment of crises, both the Counseling Center and myself in the work I do, we want to make sure you all as students have outlets for externalization, making sure you stay connected, and moments of self-reflection. So if you need additional help or support with that, please reach out to myself or the Counseling Center. My email is pblung@uci.edu. I'll pause there. Thank you.
Thank you so much. And I do really strongly encourage everyone to take advantage of the wellness activities that both offered by Graduate Division and the Counseling Center, as well as other places on campus. And particularly as you're feeling trapped more and more indoors and more feeling apart, those are a great outlet for you. So I'm going to return now to a couple of things that were mentioned earlier, but we'll have some additional expertise there. So first to Dr. Chang, who is the medical director for the Student Health Center. And even if the Student Health Center is not your primary care physician, it is good to know about the things that they do there. They are handling a lot of our testing and care around COVID on campus, as well as many other things. So over to you, Dr. Chang.
Thanks so much, Jillian, and thanks for you all to participating here today. It's great for me just to hear the update from all of our partners about some of the resources that we do have on our campus for our students, for our staff and faculty, but also the challenges. I wanted to thank Scott for his update about ergonomics and ergometrics. So it's so difficult being a clinician right now because all of those things that we typically say about good health and activity and getting out and being about, we can no longer really say. And so we know it's impacting, right, the day-to-day lives of our students and our patients, but we also adapt. We also kind of modify and we come up with ideas and ways to keep ourselves leading good and healthy lives. And hearing from Francis and Fong, right, mental health is essential. It's critical, right? For us at Student Health, it's hand in hand, it's a collaboration. So having these resources, I think, are essential. And for each of you to explore what works best for you. You know, if you haven't explored and seen what's available, take a good look. You know, we have so much that's there, but we have to reach out and take advantage of it. So my talk today is really going to be more of an update. So I'm breaking it down into two parts. One is, you know, just basic care again during the time of COVID, taking care of ourselves. And then I'm going to talk a little bit about some of the testing that we've been doing, the surveillance or asymptomatic testing. So this building you see behind me, that's our Student Health Center. And as Jillian mentioned, we might not be your PCPs, but we are always here to support issues, questions, and concerns. And we as essential workers have been open from the start. We never cut closed. However, we did adapt ourselves in many ways. So telehealth is now the way of kind of the future, but the way of the now. So communicating like this, you know, we've all been reduced to kind of looking at laptops and doing things through virtual means, but this is a safer means for even providers to see patients if it can be done this way. So I can't listen to your lungs, I can't palpate your stomach. You know, there are certain things I can't do, but getting a good history, getting a good evaluation, determining what may have been the cause or kind of current symptoms helps us to make those, you know, virtual diagnoses. We are still open for face-to-face care for sure. There are a lot of things that are procedures that need to be done. Or for some of our students and even our providers, a face-to-face visit is still that critical, essential connection point. Now for the face-to-face visits, we are asking our students to be sure and fill out your daily symptom screener. Even if you're coming in to be seen for a symptom, it's good to know because you may be coming in for a rash to be evaluated, but if you have fever and cough that morning, you may be coming in through a different entrance. We have negative pressure rooms, we have isolation areas within our site. And we do have a screening process for each of the students coming in, as well as each of our staff and employees. You know, some of our students think that the Student Health Center is sometimes the safest place to be, but truly guys, like we have 6 students coming to our center. We have people with fever and coughs. So we have COVID positive people coming through. So if we can do things from a distance perspective, it's always a safer thing to do, that first step. And we're making sure that anyone coming into our Student Health Center is really being screened for symptoms, is really been checked out so that we're not passing transmission of any kind of contagion. Another thing that we put into place is the drive-through testing site. So instead of having to come in for your COVID test and be in a room with medical assistants, providers, and nurses all moving through, we can do the initial conversation through telehealth, determine your symptoms, determine your exposure, look at previous testing, and then order the test to be done as a drive-through. So you really do not leave your car, you drive up. Our nurse in full PPE, that's personal protective equipment, will get the sample. We also check a quick pulse ox to make sure your lungs are still working, and then give you directions on how to follow up. And that goes into our testing system. For those students that don't have a car, it's a walk-up system as well. So you can walk up, get your test done, and then return back. So minimizing contact when it's not there, but always having the availability. You know, from the start, we've been following our CDC guidelines for testing protocols and isolation and quarantine. And this has been evolving and changing through these last few months. It's much easier now that we have our test kits available, now that we have our processes available, and our turnaround time for results is improving to get a test. The first few months of COVID, it was difficult even to know what kind of test was appropriate. The turnaround time was sometimes 4 to 5 or 6 days. But now that we've been through this, now that we've been stockpiling and having a test kits available, we're doing tests. And that's important because we're seeing that the symptoms of COVID have been evolving and changing. We always know high fever, strong cough, shortness of breath. These are the things that can lead to pneumonias. And pneumonias are the most kind of distressing and worrisome effect of COVID, leading to hospitalization, ICU care, and sometimes fatality. But we are now seeing students with you know, aches and pains, headaches, GI symptoms like vomiting, diarrhea. And one that's been classic is lack of taste or smell. When we see some of these more subtle symptoms, in the past, we might have thought, oh, this is just a stomach flu or this is just something else. We're testing now because we have the kits available. And we're seeing that it may be not a classic symptom of COVID, but a subtle symptom. And we're finding positives that way. So the the bar for testing has been lowered. And so there should really be no challenges to get that test done appropriately, right? Done that right best way, and then followed up on afterwards. So our symptomatic testing really has continued to progress with the time and with the changes. One big part of it for you all is to really do your daily symptom screener. So I know it's kind of a pain to do, right? I'm doing it and I'm getting used to it, and I'm a doctor, right? So I got to remind myself, like, how am I feeling today? A few questions, we've added a few more questions on there. And this is just good common behavior. Like, everyone who wakes up should think, how do I feel today, right? And if I don't feel so good, should I be interacting with others? Should I be going in for any kind of work or even coursework? Or should I do a better step to take care of myself? So the daily symptom screener has been, it's a reminder of what we should be doing. It's a reminder about where you might be through that day and minimizing exposures. Our team is trained to handle the yes responses and to evaluate the risk of a true COVID type infection or any other condition not by me popping up. Allergies and asthma are popping up. A lot of our students have chronic diseases like, diabetes or even more severe things that can be acting up also. So we want to make sure that we're continuing to provide that best level of symptom-based care, and we're here for you to reach out to. So symptoms is always something to keep your eye on, but asymptomatic testing is another field altogether. So we've been doing this for a couple of months now. And I think the thought went this way. A lot of students were moved off campus back in March and April when it was really starting to get heavier with COVID cases. And that was to keep students away from the classrooms and not having roommates that were sleeping 4 or 5 feet away from you. And we went down to about 3,000 students living on campus, many graduate students, many with families that didn't have options to move off. The decision to move students back on campus in the fall was one that we really had to think seriously about, because we may be putting people into environments around others that might place them at higher risk. But the truth was, many of our students were living in higher risk situations at home, where they may have multiple family members, elderly family members, or not the resources that they might have to do well academically here on campus. So we said, let's bring them on campus, but we have to ensure a safe environment. We were lucky in that, being a quarter system, a lot of our semester system campuses went first. And we remember, right, reading those articles late summer and even now, that college populations are skyrocketing, that these are where clusters happen. This is where it's not just a balance of structure and testing, but behavior. And we realized that we better do something to identify some of those cases, especially when asymptomatic disease and infection is out there. And some reports will say that up to 20, even up to 40% of COVID positive cases may be asymptomatic and not even know that they've been infected. So we developed the asymptomatic screening process. Many of you that are living on campus have been through this, and it's currently working out of 5 of our sites on campus, 4 different residential areas, 1 for athletics in particular. Athletics has a specific set of guidelines when it comes to testing. We've been doing this for several weeks now, so most of our students are pretty routine with the process. We're using a nasal swab PCR, so polymerase chain reaction RNA test, which is that gold standard, which just gives us the highest level of determination of positives and true positives. And it's going quite well. We've been maxing out our sites so that we are doing over 1,000 tests per day on campus. If you told me that right months ago, I'd say there's no way we could do 1,000. When we were doing just symptomatic, at the most, 12 was kind of our heaviest. So we've exponentially increased the amount of tests that we do. But we've also been doing the testing under the safest, best precautions. We started with outdoor testing, making sure to be spaced 6 feet apart. We know that outdoor is best because Mother Nature's ventilation is a good thing. However, Mother Nature can also cause wildfires and air quality can go down. So we realized that there was a risk to having just outdoors. So we brought many of our sites indoors now, making sure once again that the ventilation, that the airflow, that the spacing, that the process is safe for specimen collection. Once again, we're doing nasal swabs at this point. We are looking at some other sample collection methods as well. So saliva testing is something that's coming up. And there's another process of testing called antigen testing, which is not as, I would say, not as specific or as accurate as some of the PCR testing that we do. But if it's done in conjunction with PCR, it may allow us to do some different levels. So we're looking at those options there and continuing to keep on that highest quality, the best performance, as well as the convenience and opportunities for our students to participate. Each of our testing sites has a first aid room, which can be used for accommodations. For example, some of our students that may have disabilities, which prohibits their ability to even get a nasal swab, or visual disabilities, or for some of our students that do have chronic medical conditions that are at a state of immunosuppression, and it's just not best to be around others, we can provide that level of care in a isolated family, an isolated first aid room. And then finally, for our students that have families and are unable to, have someone watch their children, the first aid rooms have been great, because it's difficult for anyone being tested to see a child that's kind of moving around. And so the first aid rooms allow for a more personal experience with our staff to provide for accommodations or special needs when they're there. So we've been really working on fine-tuning the process, improving what we can all along the way, increasing our capacity to test populations without jeopardizing the quality and the safety of what we do. And so, I just wanted to kind of end with that and say that we're continuing to move forward. We're collaborating with all of our partners on campus, and the feedback that you all provide has been essential for us to build that best system. So I'll go ahead and wrap it up there.
Thank you so much. And we do have one final panelist, and then I promise we'll get to your questions. We did have some come in through email as well as in the chat. But over to Sharon Robert, who some of you know because some of you are trained contact tracers, and she was in charge of that work. So thank you for that.
Yeah, thank you. I'll keep it short so that we can get to questions. The biggest thing last spring was trying to address how we were going to address COVID, hitting campus and hitting Orange County. So after many discussions with Orange County Healthcare Agency and leadership on campus, the Health Equity Contact Tracing Workshop was developed. And there were a few reasons for that. Actually, there were many reasons for that, but a few of them were, included having the students doing something involved with this to understand the importance and to also gain a sense of community. As David mentioned earlier, you get the call, you're worried about giving someone's name away, that you're going to get in trouble, or that you're kind of showing something that maybe you shouldn't be showing behind the curtain. But when you talk to a community and you go to the areas that are hardest hit by this pandemic, and you have buy-in and understanding, it's easier for contact tracers to go through and talk to people so they can understand how their responses really do help their community and help the response, help doctors and vaccinations and moving forward in order to stop the spread. So when we created the workshop, we did do it through a health equity lens, and what we were hoping to accomplish, and I think we did, was to reveal that pandemics and viruses do affect different communities and populations very differently. And this pandemic, I think, revealed to society, not just locally, but nationally and on a global scale, the inequities that are out there and the health inequities that are out there. And public health really drives and strives to solve those inequities and to help put a stop to that. I think that Dean Bowman-Malbala, it's her passion on health equity. It's really a mission of public health practitioners. And this workshop really highlighted that, and to make sure that when we're going out in the public and we're seeing the communities that are hit the hardest, how do we address that? How do we understand why certain communities are hit harder than other communities? Why are there certain pods of people who are getting ill? How can we approach communities that may be completely different from us? There's a cultural competency and sensitivity that goes into that. It's not just barging into a home and asking everybody, where they've been. There are things that need to be addressed and talked to about that. So a lot of the workshop was developed in order to address that. And I think now, I would say society really sees how important public health is to all of the decisions out there. Businesses reopen, education, policy, and with this, we knew we were going to need contact tracers. We knew there was a gap. The students now understand, and I have to say, most of the students that did the contact tracing over the summer were not public health students. They were from all disciplines. And I think David can attest to the team that's in the call center. They're very interested. They wanted to learn more. They're really doing a great job. And it's really good to see that so many students really wanted to be part of this team to get life back to normal, as we hope to see it soon. That's all. Thank you.
Thank you so much for that, and for all of the work that the contact tracing program is doing. We've got some questions in beforehand, a couple of which that are quick and easy. So I'll give our panelists a moment to breathe and I can answer those. So one is regarding grading and timelines. So TA's feeling a lot of stress about getting their grading done on time while we're simultaneously asking for flexibility to support the undergraduate students as much as possible and to support faculty in their mission as much as possible. And so I will simply answer this with, to some degree, this is a local question. And if you're having issues and concerns, talk to your department chair, talk to your grad advisor locally. And if it gets too problematic, come talk to me for sure directly during office hours, but mostly to the faculty and staff who are on this call. And I see the names, so I know there are some of you. Please do afford your TAs the same flexibility and generosity and benefits that you are asking for yourself and that we have already asked you to give to your students. We are all in this together and we just have to be generous as much as possible while recognizing that, of course, we have to get grades in by a certain time. So I'll just put that there. The second relatively quick question that we got ahead of time is if COVID rates stay high, would we be forcing students to come back in the spring? That is a very easy question for me to answer. The answer is a solid no. And I promise you that there are some folks on this call probably who would like you all to not come back for quite some time, right? We want the risk of transmission and the risk to your health limited as much as possible. So no, we are certainly not in the business of forcing you to come back to campus before time is ready. So with that, I'll push over to a question that not only has been asked in the chat, but got an upvote. So we know that people really want to know this. I think this is probably best answered by Albert Chang, although I know the staff member of his who would answer this is not on this call. But if you could speak a little bit to the USHIP coverage for COVID.
For sure, guys. So the Anthem plan, which is the USHIP plan, is definitely covering, so for sure, symptomatic testing, medically necessary testing for any kind of COVID-related illness or problem. And they're covering the cost of any COVID-related treatments, illness, hospitalizations. So if you have COVID and you've been diagnosed and your complication for pneumonia or whatever is based on your COVID, it definitely will be covered through the Anthem, through the USHIP plan. If you have COVID and you break your leg, they're not going to cover breaking your leg, right? But for anything that's COVID related, for sure. Now, insurance plans are typically not covering what's called a non-medically necessary testing, which, for example, is the asymptomatic testing that we're doing for all students on campus. That is being covered by the university. So there are some plans that may cover some screening, but typically they don't. So for our population under the USHIP plan, testing for symptomatic cases is covered. Treatment for COVID-related illness admissions is covered for sure.
Sorry, I was going to tell you to stay unmuted because I've got another one for you, which came in both ahead of time in a couple of questions and also came in the chat. So we know this is important to folks. If you could talk a little bit about the differences in efficacy between someone else sticking a Q-tip up your nose and you doing it yourself. That's my very medical way of describing the question.
Right. So we've been doing what's called nasal pharyngeal. So nasal is kind of the front, pharynx is kind of the back. So a nasal pharyngeal swab is not a very comfortable test to do. It actually goes quite far back and you need to rotate for 10 seconds. Those of you that have had it done, it's not, once again, it's not the best feeling. So recently, or within the last few months, a new process called the anterior nares or nasal swab has been developed where it collects samples here at the front of the nose. And the question that I had in the beginning for sure was, Well, are you going to catch as much sample? Are you going to jeopardize the collection of the specimen? And all studies have shown that they're definitely comparable. Now, it still has to be a good sample. You can't just put the Q-tip there and just kind of dibble it around. You've got to really go through the mucosa. One of the reasons for this is that when you do have COVID, it actually spreads pretty well throughout. And the testing for the PCR, that's the polymerase chain reaction test that looks at RNA fragments, is actually quite sensitive. So it's PCR for the nasal pharyngeal and the nasal. Now, when it comes to testing platforms that our lab does, there are probably half a dozen or more different PCR testing platforms that we use internally. And that is for the ICU patients, that is for the hospitalized patients, that's for our mass screening and testing. And because of the volume, so over 1,000 tests from us coming from asymptomatic screening, it is done on a certain platform. Now, if that platform catches it as positive, it's positive. If it's marginal, it gets retested. And if it's a negative, they do a tie-breaking retest. So that's all handled by the laboratory itself. It is not to say that our asymptomatic testing is less accurate, less effective. It's just that it's done on a different platform that when there are questionables, it does get raised to that higher level. For the symptomatic cases, so this is someone with symptoms, we don't want to jeopardize any kind of questionable result. So those are the cases we still want to do the nasal pharyngeal. That's a bit deeper of a swab, right, for that. The other benefit of the nasal swab, it allows us to do it as a self-collected specimen. No one is doing self-collected nasal pharyngeal swabs, right? And that would take a lot of time for a nurse to do that 1,000 times per day. We have the self-observe, which allows 5 students to do them self-observed with one kind of director making sure you're doing it. And the key here is that after weeks and weeks and weeks of doing it, we're seeing that the students are doing it pretty routinely. So we're getting good specimen collection and we're working things out that way. So both PCR tests are effective or accurate. The platforms may be a bit different, and we have systems to double check and triple check on the back end as well.
Great, thank you so much. And now we've got a pair of policy questions, so we'll try to hand those to David together. The first one, which I think is the quicker and easier question, is regarding today's travel warning by the governor. And then the second one is regarding, if you could clarify, David, particularly outdoors while wearing a face covering, any socializations, what the policy is for students and what the risk is for them. The particular question here is about the risk of suspension.
Sure, thank you. I'll tackle the travel question first. I've been in meetings all day, so I actually had to quickly Google what the governor did today. So I just did that. so whoever asked, thanks for heads upping me so I could take a look. So looking at it pretty quickly, I think, and I will say that given that it's just come out, we as a campus will have to review. But I think our existing travel policy on campus, the chancellor's directive on travel, as well as the directions that'll be coming out to those of you who live in on-campus housing related to travel, are pretty consistent. So for example, the governor's travel advisory is basically if you travel in from out of state. So let's say you go home to Washington for Thanksgiving and then want to come back to campus. The advisory is for 14 days of quarantine. We're essentially requiring that for anybody who travels off campus and comes back on campus. So I think that's consistent. And I think that's also consistent with the chancellor's directive, but we will take a look at that. And if there are any changes or adjustments to the travel policy, we will of course communicate that. I think it does, though, essentially just underscore what I said at the front of the presentation today, which is we really don't want people traveling for the holidays unless it is essential to travel. And we really want people staying with their immediate households for the holidays. And that really has to do with the fact of these rising case rates that are taking place all across the country, including here in California. Our California weekly case counts have doubled in the last month. So, I mean, that just gives you an indication of how significant things are increasing. Then the second question was related to gatherings and masking. And, what I will say to that is that, we as a campus community are not looking to suspend people, right? We are not on the hunt to try and do gotchas or catch people. We are really providing guidance to help all of us reduce our risk as best as possible. So we are always encouraging that while you are around other people, that you are masked and that you are physically distanced. We have to do that when we go to the grocery store, when we go out to grab food, if we're grabbing takeout, et cetera. We'd expect you to do that while you're on the campus as well. We have tried to create in undergraduate housing the pods, the Zot pods, to allow individuals to be able to socialize within their pods, because we know the challenges that are created with this pandemic and all of us needing to really kind of stay apart for our own health and safety, and also for the health and safety of our communities. And we are working with student housing and student affairs to put together a proposal for creating pod opportunities for graduate students as well, because we realize with many folks who are living in apartments, that doesn't give you a whole lot of people to socialize with if you are in a much smaller living unit with just one other person in your apartment. So we are working on that as well. So our goal is really to see that folks are taking all of the steps necessary to protect. And we are not encouraging gatherings, and really are encouraging folks again to wear masks and be physically distanced.
Thank you, David. And I will, okay, Hannah here is asking a very specific question. So can a graduate student meet a person masked and at a distance outside under the current policy?
We would encourage whenever possible that when you're doing that with folks who are in your household, so in your apartment currently, or as we get the pods up and going, we would really strongly encourage that. That's where the social interaction occurs.
So I will just add to that I know a lot of people have been working on this policy, and the AGS reps did have a good long talk with the folks from Student Affairs yesterday that I was there for as well. So I would expect some policy changes soon, although soon in a university the size of this one and in the middle of a pandemic is perhaps not as soon as anyone would like, but there is a lot of work going on in that space.
And Jillian, can I just add one more point to that? I mean, I will say, and I appreciate that. And, we have had some situations of student discipline that have occurred, but it hasn't been one person outside wearing a mask 6 or 10 feet from another person. It has been in situations where people have been unmasked, where they've been together, where other issues are going on. So our goal really, again, if we think about this from the public health perspective, we really want to keep people in smaller units together and separated from each other. So that's really the goal that we're trying to achieve here. And we get that this is hard, and that the nuances of policy sometimes don't allow for very precise answers on every single permutation. And we get that, and we hear you, and we're trying to kind of figure out ways to make that more clear and still protective, if that makes sense.
Yes, thank you. And it is coming up on 4. So I will just close with saying we did get a couple of questions beforehand asking what the process is by which the various policies are happening. And although it depends on which policy, what the answer to that question is, the main thing I just want you all to know is that it's an incredibly consultative process, which is part of why things are not fast. So what I have seen is the folks on this call, as well as many others, talking with the faculty senate, talking with the AGS reps, talking with the grad housing elected reps there, just trying to really talk to everyone. And I'll be honest, the decisions on policies are not always the same I wish they would be. And I'm sure they're not always the same that anyone wishes they would be, because this is an incredibly complicated and thorny set of issues. And so no matter what policies are decided, everyone's unlikely to agree across the board. So thank you all for your continued patience, for your collaborative spirit, for giving feedback, which you can continue to send through me, through Fong, through anyone on this call, through your AGS reps. Keep sending your feedback, keep asking questions, and we will keep iterating on responses as the public health context and the campus contexts change. So thank you again to all of you for coming to this panel on a Friday afternoon and giving up your time. And thank you to all the panelists for providing all of this really important information This panel will be archived online within the next week, so you can come back to this, and I'll give my final disclaimer now, which is in this COVID world, everything changes really rapidly. So if you are watching this far from November 13th, 2020, I disavow everything that was said, and please see the latest information that is available from the whatever sources that we have them on. So thank you again, everyone. Really appreciate the wonderful spirit, and have a great weekend.